way, I've actually ordered like an outdoor what do you call it, outdoor seating thing that swings with like an umbrella thing. I don't know what it's called. Looking forward to having that and just swing it when we get a dog finally. The dog will be, and it's just so exciting for me. Wanted to give an update on the braces situation. I just had my third braces adjustment. As you may know already, I've asked to place brackets on my last teeth in both arches. Bear in mind I don't have two teeth here, so they placed brackets on the tooth here, here and here. And oh my gosh, it has been so painful. When I got my braces first 3 months ago, so I was in a little bit of pain, you know, but it wasn't just like a pain, it was like a tension and stuff. Very unusual feeling because I didn't have braces before, but this time around it was so bad. I kept waking up, it was awful. And I think the reason for that, the roots of those back teeth are so big because they're like molars, they're big. Moving those teeth is like a much bigger thing than moving teeth at the front, whose roots aren't as big. So the changes that are being made at the moment are so much bigger than the changes that were made here with this teeth. I think that I feel it like much more, and it hurt a lot in the first couple of days, but now it's okay-ish. I think today is day 3 or 4 or something. The only thing that hurts is my gum is being torn by the brackets here on both sides, and it freaking hurts so much as well. I'm supposed to put wax on it, but I'm not doing that. I haven't put any wax on it because my theory is that I should just wait a bit until my gum becomes hardened by this, so it gets used to it. This is what I've done before when I just got braces. I didn't put any wax and it worked, so this is what I'm trying to do with this as well, hoping that it will help. But I'm also editing the footage that I took from this week that just passed, and looking back at everything that I said and everything that I felt, it's a bit of a surreal experience. I've had a day off yesterday and I have a day off today, so I feel a bit more chill and relaxed. And looking back at how much stress I was experiencing this week, it truly is an eye-opening experience for me to look back at it. Like, surely had I not filmed anything, all I would have remembered today was that I had a stressful week, and that's it, you know, literally it. However, when I'm editing those clips right now, I'm seeing the stages of stress I'm going through and how much it has been affecting me. It is eye-opening, and it does teach me a lot about myself, just helping me understand myself better. It's healing somewhat. By the way, I wanted to say that I think I got slightly misdiagnosed in regards to what I have. Well, apart from everything that she said I have, I think I also have a crossbite, and the reason why I think I have it is the more straight and aligned my teeth get. So at the moment my teeth are like angled, the bottom ones, especially the back ones, they're like angled in, and the top teeth in my top jaw is angled out in order for the top jaw to like sit on top of the bottom jaw and somewhat stop the bottom one from growing even more. Anyway, now that I have the brackets attached to every single one of my teeth, I feel now that my teeth have started to like stand up vertically, align vertically. The misalignment that I originally had on this side where I have my TMJ is becoming more and more exposed and vivid, and it looks like I will have something like that when the braces do their job. I don't know, it just feels like there's so much stuff that's happening, and it's tiring, man. It's really tiring. I just want to be done with it. It's fucking annoying, and it's just the beginning of the process, you know. I feel like people have the majority of issues after the surgery, when they have to physically go through the process of healing and accepting their new, all the changes that's been made. That is truly challenging, right? But what I'm going through at the moment is really challenging for me already. Why am I putting myself through it? There's no reason for it. You have no idea what dreams I'm dreaming of. It's like crazy. Everything is proper messy. So I do say that I'm trying to take it slow every vlog. I can't relax. I really can't chill. I went out for a little longboarding session, and I found gigantic ginormous horse field with horses, and I just really wanna like just say hi. They're just so far away. Like GoPro makes it seem like they're so far away, but they're literally like right here. You know, on this Facebook group, some people are super helpful. They will just go out of their way to support you because they understand how frustrating the process can be. But sometimes you get people who are just, the way they phrase their questions is as if they just want to drag information out of you, as if you owe it to them, you know, as if like, I've had my orthodontic adjustment on Thursday, today's Sunday, so it's 4 days. And I've noticed even before the orthodontic adjustment, I had some pain on this side of my bottom jaw. I kind of thought the pain was because teeth were being moved, because there's 2 teeth that need to be moved like outwards. I didn't pay much attention to that. But then today, I've started noticing crazy bad pain right here, and it's painful to the touch. I'm not sure that it is related to the movement of my teeth. I think something else is happening. The bracket was placed on the last tooth here. I can feel the root of that tooth, I think. I mean, nothing hurts there. But the tooth right next to that last one is not in a good shape. In fact, there's like a temporary crown on it, and I have a feeling something is happening to that root. Maybe because the teeth surrounding that root, the movement of those teeth is messing with that root somehow. It hurts a lot, and I've just been to an orthodontist. It wasn't bothering me that much. It was just painful to like eat on, but now it proper hurts.
Welcome to 107 Harley Street. Press 1 for COVID testing, press 2 for the maxillofacial clinic, or press... Morning, 107 Harley Street, can I help?
Hi, hello. I have an inquiry regarding maxillofacial surgeries. I've heard you guys do that in your clinic. Is that correct?
Yeah, so that would be Professor Shakib you would need to come and see first. So he's a maxillofacial surgeon.
Right.
So you need to come in for the initial consultation and examination to begin with, and then he can guide you through the process of what can be done in your case.
At the moment, I'm in the middle of the braces treatment to decompensate my jaws for the surgery, and I actually have a referral letter from my orthodontist to be seen by a surgeon, and I'm basically shopping around for surgeons at the moment. I have one in mind already, and I just need to get a second opinion. Also, I was wondering if Dr. Shakib works with AXA insurance.
Yes, he does. The only thing we wouldn't be able to tell you is the cost of the surgery because, well, I suppose you'll be going through insurance anyway, but this would be something that you would both decide what exactly you need doing during the first appointment, basically.
Yeah, no problem. I'm aware of the costs and stuff roughly, so that's fine. I was wondering if he had any. Do you know by any chance if he had any experience referring patients to AXA to getting that insurance?
Oh yeah, we have lots of patients with AXA.
If I was to have a consultation, how much would it cost and how available is the doctor for a consultation?
So we're booking for May now, and for a consultation, are you not covered by AXA for your consultation?
I haven't submitted my claim yet. I'm trying to build a case to submit to AXA, and for that case, like, I would need a report from my surgeon. I want to have that consultation first, pay out of pocket for the consultation and get a report for AXA.
Okay, I understand, that's fine. So for a new patient, it's £300. A letter with basically a summary of what you've discussed and his recommendations and, you know, a treatment plan, basically, what you would do. Diary to load, but I think it was Thursday the 6th of May, or Thursday the 6th or Monday the 10th.
Okay, one last question. How often does he do surgeries? I'm wondering what the experience is and how often.
Well, we do them every week, and usually Wednesdays or Tuesday would be our surgery day.
Ah, so you literally do it every week because there's so many of them.
Well, he's a surgeon, so yeah.
Ah, okay, yeah, well, fair enough.
That's his job.
You could probably imagine I'm a bit anxious about this because it's a really invasive procedure, and
Yes.
I know that you're probably like required to say certain things. My biggest question from patient side, I think I'd say, is that how good of a surgeon he is, because I'm really paranoid at the moment. I read a lot of really strange reviews online about various surgeons and various orthodontists, so I'm quite conscious as to who I should trust, you know. Have you had any...
Well, the thing is, because every patient, you need to remember that every patient has a different case.
Yeah.
So there's never two patients with the same thing, and the approach will be always different for every patient, and you will recommend something that is specific to you.
Yeah.
He'll probably want you to have some imaging done, maybe a CBCT scan or an MRI or whatever it is, so he can have a look at the bone structure, and then he'll tell you what exactly he's doing. Obviously, you will hear different things from different patients, but you need to remember that every case is totally different, and two experiences will never be the same.
Yeah. So, no, it's true, definitely.
Especially if a surgery is not a minor procedure we're talking about. It's a big surgery.
Yeah.
So yeah, there's not much we can say really. Yeah.
Okay, and if I am to do this MRI scans and CT scans and stuff, will they be included in the cost of the consultation?
The what, sorry, the scans?
Yeah.
No, the scans would go on top of it, so the cost it depends on what scan it is. It's between £80 and 200. But if it's something like an MRI, if he wants you to do, then he would need to refer you to the place that would do an MRI scan for you. So that would be a separate cost, which is MRIs are usually more expensive.
Okay. You know what? If you could please book me in for Thursday, if possible. I think it's been 2 weeks since I planted. Shit, I should have like wrote down the date when I planted this flowers, because I think it's at 2 to 3 weeks is the time frame from start to finish when they should show up. So far there's nothing there. My roses died. Like, I'm actually so pissed off about the fact that they died. Like, what happened? Like, literally what on earth could have happened? I've been watering them, giving them food and stuff. Maybe it's just like the blossom thing that like died. Like, it's fine, because I'm seeing, I think these are the new leaves that are coming through, so it's not all lost. It's everything else is, yeah, nothing is showing up yet. By the way, I have no idea how often I water them. So far I've been doing it once a week on a Saturday, and it's been raining, so I think it has contributed to the whole watering situation. Son of a bitch. Like, what the actual fuck? There's like literally a place of murder. Like, what the hell? Why is it happening? Is it like a bird? Like, what's going on? What the fuck? I booked a consultation for the 6th of May, which is next week Thursday. I'm not sure if I made the right decision, but I think I'm overthinking it. I just need to see a surgeon and just, check everything and hear their opinion and stuff, and just, I only have 2 weeks, like a week and a half until this freaking consultation, so I really don't need to stress about anything.